Oh. I don't know how to answer that.
You don't? Oh, well, I'm doing pretty good. Yeah.
You always look gorgeous.
Well, thank you.
Your style is so wonderful.
Thank you. I had a pretty good day. Before I came here, I went and worked out for a while, and then took a nice walk with my dog, and had lunch with some friends, and then thought I better do some work, so here I am.
Sounds like you have a normal life.
Well, I don't know. But those are some things I enjoy. Yeah, let's talk about you.
No.
You've been at work today?
Yeah, and I lost my temper.
Really?
I'm just shook. I just can't believe I did it to this poor, sweet, little bit on the periphery student that was my assistant right now, and she didn't deserve what I did, and it was insane. It's crazy, this behavior that's starting for me.
You think you're going to get in trouble?
Well, I may. I mean, I'm going to get over them if we don't lose our tempers with students like that. I mean, and I'm new. I mean, and people, and also, I mean, I've been here, how long have I been here? About a year, but still, I mean, it's just that I'm all over the place. The news that I just got has set me off. The news about has set me off into this state of mind of late.
What news?
Well, two of the students from Santa Fe, survivors of the shooting, committed suicide.
Yeah, I don't think I can handle that.
You can
talk about that.
You can handle it?
No.
Oh, you don't. You don't. I'm confused.
Well, yeah, I mean, students committing suicide, that's
that's not in your...
No, I just can't deal with that. It's like, too upsetting.
That's not part of your practice as someone who's dealing with a suicide?
No, I don't like to talk about suicide.
Oh.
I mean, suicide is just awful. It kind of gives me the creeps.
Well, what about, I mean, you know that I was witness to a shooting. You can handle that?
Well, that's a little better.
Better?
Well, suicide is something you do yourself.
Yeah.
So I just, when I was in school, we learned about suicide and suicide. I couldn't even stay for those classes. So I would just leave the room and just do the assignment. It's like,
Is it just with the violence of it, or is it that just taking your own life?
Just that thought of taking your own life. I mean, I grew up Catholic.
Me too.
Life, you go to hell. That's what I was taught.
Oh, yeah. Well, yeah, I mean, I'm half Mexican. Got a huge, everything's the Virgin.
Yeah, so I mean, I grew up with that.
Right, you go to hell. Not in purgatory, you go to hell.
Right. And so,
right.
I learned from that young that you don't talk about suicide, you don't think about it, you don't do it. It's bad.
You've been thinking about it?
So
I've forgotten. I've gotten so far away from my religion.
That's easy to do. But, so I just decided I was never going to deal with suicide.
Do you have it in the fine print somewhere?
I think referring you to someone. Yeah, I should. I really should. I've not put that in my disclosure, but thank you. It's a good idea that's an exclusion. That's something I don't work with. Because it's, I just can't go there. But, I can help you find someone and talk to you about it if you want to. I've got some good friends, therapists, who could do it.
Does that mean I'd still see you? Or would you want to still see me?
I like talking to you. I'd be happy to see you and meet people for my practice. It's kind of
Yeah. But
just have it at people, so it'd be great to have you. But I just can't talk about suicide. I mean, we can talk about anything else
anything else.
but suicide.
What if I was suicidal?
Well, then I'd probably.
I mean, it's crossed my mind that I would never do it, but I've had some very self-deprecating feelings.
We don't have to worry about that.
Well, I can't. I mean, I can't. I'm not so much worried about hell, because that's just what I'm in anyway. I mean, I'm in living hell.
I feel like you're in hell.
I feel like I got thrown into hell.
What do you mean?
I mean, the feelings that I have about what I've been through in the last 2 years, I don't even know what normal feeling of being a human being is. And I feel like this is who I am now. I'm this walking sinner. I mean, this has all evolved because of the unmentionable, the 2 suicides. This has all come back for me. But that's okay. I guess to get through the rest of this session, I'll not, maybe we'll be able to think about this. This is really confusing. But I just, I mean, I do feel an attachment to you.
Take some deep breaths. Yeah, okay.
Wow, it's so interesting. Because if I was suicidal, as long as I promised you I'm not going to do it, you would see me.
Yeah, you told me you'd never do it.
You believe me?
Yeah, believe me.
No, but
I should believe you.
Yeah, you should believe me. I think you should believe me, even if I say I would never do it. When I'm not, I do. I have a son, and my son mostly. My husband, he'd survive, but his son, he's just a mess because one of his friends was one of that, and also he lost a friend in the shooting. So we're both just a mess. I can't do that to him. I wouldn't do that to him.
Yeah, so that's great. If you know you're not going to do it.
Well, as long as he's living at home.
Good.
I mean, I might walk into a bus.
But I wish she'd stop talking about this. I'm starting to feel a little frustrated.
Well, maybe we really need to lift the fact that maybe I am. I mean, I do have violent thoughts about myself, but that doesn't mean I do it. But I could walk into a bus.
Can we just talk about something else?
Okay.
I mean, I know you've got a lot going on because you told me so many things.
I know. I feel like
you should be able to talk about something else, right?
Yeah, I mean, I almost feel like, am I trying to be some kind of celebrity with this thing? I just feel like I'm so marked and so different now now that these 2 incidents came up, it brought it all back, so I'm back in the soup again. It's all over me again. It's all over me, and I
don't like that.
No, I mean, it's like the blood is still on me. I mean, I have blood on me, and I lost it with this girl, this sweet little girl today, my assistant, and she didn't deserve that.
Mary, how long has it been now? It's been about a year.
Has it? Yeah, because we moved.
Yeah, so
it's been a year.
It's been time to start moving on and getting over it. You could
maybe I'm hanging on to it because I think makes me special. I don't know.
I don't see how we make you special.
Well, when I tell somebody, and I have it, really, I mean, the school knows. The fact they know, they do look at me a little askance.
Yeah.
I think they're more walking on eggshells than anything. I mean, I would feel very strange if I saw someone across the hall who'd been part of this, because it's everyone's worst fear. every high school.
And the school, that every teacher's scared of that.
Everybody, it's everyone's
Right.
worst nightmare. It's every parent's worst nightmare.
Right.
It's how we all live now. You know, and I get to go to school with my son, so I get to at least know where he is, and he's down the hall, or, you know, it's kind of nice, but he was there the day it all happened, and, you know, so I could really seem like kind of a jinx to the rest of the school, or unless I could, because we weren't awake. Even with all the past shootings, we weren't awake to the pain of the boy that did this terrible deed. And,
Yeah, that's too bad.
you know,
That's something I didn't see it coming.
well, he talked to me. A little bit, but not really, because he shrugged it off. He was kind of cavalier.
Yeah, that's tough.
It's too much.
I'm really tired.
At least you're making me laugh. I don't laugh that often. Like, are you for real? Is this really happening?
Yeah, I just feel exhausted all of a sudden.
You weren't like this when I saw you last time.
Well, I don't think we weren't talking about this.
Suicide. We weren't. Oh, it's almost like
That's,
it makes me want to talk about it. But, oh my God, I feel really weird.
we just rest for a second.
Okay.
I mean, I don't want to fall asleep during the session. I actually do that once.
You did?
Yeah.
I fell asleep waitressing once.
I do.
Right, and I was standing taking an order, and I fell asleep. I had never.
So then you would.
I do.
How did you wake up?
It was only a second,
Oh,
but I went out. I hadn't had any sleep from
sleep deprived.
any sleep before.
No, you were just talking about that. I just felt like this wave of exhaustion is coming over.
It is exhausting.
I mean, I didn't get much sleep last night, but
Maybe you are transferring it onto you.
yeah. So now I completely forgot what you were talking about. What were you talking about
Well,
before I started to fall asleep?
you're making me laugh. I haven't laughed in a long time. I can't believe you're having this response. I haven't even been in that much therapy, so I haven't had a lot to draw on. So, and the S word, I would just think would be something as a therapist you would have to be able to deal with. But there's all different kinds of practices. So your practice is cognitive therapy, right? Get me to think in a different way.
Yes, definitely cognitive therapy, and I do help people with trauma,
Yeah, but
not
not the S word.
that.
Just totally the S word out of the picture. But
There's a lot of trauma that doesn't involve.
so my trauma with the students getting shot,
Yeah.
blasting the door down,
I
and
don't think you have to go into all the gory.
you don't want the gory detail. You don't understand what's going on.
Well, yeah, I would rather if you didn't shock me.
But it's just what's happening to our world. Is it too shocking? It's too shocking for me what's happening to our world. Kids don't shoot each other.
Right.
And I feel like I woke up into this world where I grew up in a world where school was the safe place. You know, and now I have this perfection thing, and it's not even just the iPad. It's the how she scrubs the tables, and it's I go out in my car to go home, and I go, oh, wait a minute, I didn't put that spray bottle back on the shelf. I can't go home until I go back in and make sure it's on the shelf. Or I go, oh, did I sort the primary colors? Because I like to have them sorted out. So like the blues, the white, the red, and then the pinks. If I have the pink in with the red, and I go, oh, I don't think I did that. I think maybe she just threw them in the bins, all the colors, and I have to go back. And sometimes I go back 3 times because I'll get in the car, start to cut, and think of one more thing. And
that must be so time consuming.
It is.
Why don't you get a better assistant?
It's not her. It's she. When I go back, it's all been done.
Oh, so she does do it.
Yeah, it's just I start getting this thinking of
It's
it.
in your head.
Yeah, and then And then, I go home and it's starting to flood into home now. I mean, the way my husband washes the dishes, even the sound of the water sloshing in the sink.
Right, so it's really starting to bother you.
Everything. I mean,
I can see that's a real problem.
it's becoming a real big problem for me. And I'm supposed to teach a ceramics project. It's on my curriculum coming up next because I'm supposed to do painting, drawing, sculpting, and I'm a ceramicist. Handbuilding's my thing, and I can't get near the clay because it's what we were going to do that day. And even the thought of getting my hands in the clay makes me sick. And I'm just, a mess. I'm a mess.
Yeah, that sounds good.
And it's all been triggered from the 2 S's. So
Turning for a loop. So
it has.
harder to do your job.
It is getting harder because I'm getting home about 8 o'clock at night now with all this checking and rechecking. And then, of course, now it's turning into some other things like, is the door locked? Is the door locked?
Well, I've never heard of anybody do that kind of stuff.
You haven't? That kind of perfectionism? No?
No. But I can read up on it.
Oh.
Maybe next time have some thoughts about what might help. I think it's pretty unusual. So.
Oh my God. Do you think I need to be hospitalized? I mean, I just.
No, I don't think so.
No. But
it's just not something I've heard of in my practice. So I'll read up on it though. I'll take some time. I might charge you for the time though.
To research it?
Yeah, it'll probably take me an hour or so outside of our session.
Compulsive checking?
Yeah, I'll just bill you.
I could look it up online.
Yeah, we could both look it up.
I can research it. I mean, I just keep wondering if I need medication. I was just thinking of this book I read and wondered if it would resonate in any way with you. It's called The Map of the World. Have you ever read that book? So it's about a woman who accidentally is responsible for the death of a 2-year-old. It's not about the S word. The child drowned in her pond while she was looking at a map she made when she was a child. And she can't live with the guilt and finds catharsis in being in prison. That's where she heals, in prison.
So you're thinking you want to go to prison?
Sort of. Some kind of prison. I don't know what it is. I want to be punished. I don't know. Because I didn't act on that boy. So I can't even have my own grief. Because I didn't see the signs. And it's just a mark on me. It was ebbing away since we moved. I was getting better. My husband's been great. Very helpful. He's just really kind. And my son's starting to do better. And I know I just put all my energy on him.
Yeah, he's doing better.
And then now I'm slipping again into my own crap from the 2 S's. And my son, I'm worried about him. Well, see, you can't work with me because I'm worried about him doing that. Doing the S.
Well, I'm not working with your son.
Yeah, but
we could find someone for your son to talk to about that.
Okay.
So that would be, if you're worried about him, my colleague is great with teenagers.
Oh.
His name is Brett, and he has an office just down the hall. Oh. He would be great.
Could I maybe have a session with him myself?
Oh, yeah, sure. Sure, Brett wouldn't mind.
Well, maybe we should. I'm just wondering if maybe I'm in the right place, because I think maybe I'm too much.
Oh, too much for you?
I mean, I would think of.
Maybe what we should do is arrange a time we could go out to coffee. And just meet in a setting other than here. Because maybe it's something about this room that makes everything so intense.
Do you do that?
Yeah, I do that.
Oh, you do? Huh.
There's some, Starbucks just across the street.
Oh, right, yeah, I've seen it, yeah.
We can meet over there. People would probably they know you're my patient because they know who I am.
Oh.
They know I'm a therapist. But I sometimes go there with my patients, my clients.
Do you have sessions then?
Well, I do bill people from time to time.
Oh, okay. Yeah. Kind of like phone therapy.
Right.
Yeah.
But I guess you could kind of call them a session.
Well, I think I need to think about all this, but that's a thought.
Because I want this to be a safe place.
Yeah.
But it's nice to have a place. You talk about lighter things.
Lighter?
Not all these intense things that are going on.
Well, you can always tell me if you think that would not work with me. I think I can handle it.
There's no reason I wouldn't want to work with you.
Okay.
Do you feel like that? Like I'm saying I don't want to work with you?
Well, I just feel a little censored, I guess, by not being able to.
Yeah.
Because, when I think,
See that?
when I think objectively about my situation, really before all this, I was just kind of, normal person, with problems. Yeah, I mean, raised in an ethnic home, intense Catholic, Mexican father in a woman's place is in the home, thinking I'm white, but I'm really not. A whole immigrant thing happening now. I feel like I'm one of them.
Is that why you're having some difficulty with the news? Because I haven't had the same background as you.
No, it's not that. It's just that I really think that what I have, my situation, if I was objectively, I've seen school shootings before on TV before I went through it, and I couldn't imagine it. I couldn't even imagine being one of those teachers. And when, you see the whole scenario and bowling for Columbine and all those things, I think it's a bigger than life situation and might not be for every therapist. Now that I'm immersed in it, having been there, which still feels out of body and like I wasn't there, but I was, I could imagine going to cognitive therapy, talk therapy to just try to get through some issues I had before, and behavioral, changing my thoughts, things like that. But I'm such a collage of so many things all the time going off in me that I don't know how anyone can really handle it. Maybe I need shock therapy. I don't know, just to get rid of all the thoughts.
Yeah, that's an interesting idea. I don't know. I don't know too much about shock therapy.
Yeah. I think it still goes on, doesn't it?
Yeah, it does.
Sometimes I wish I could have something like that. Or maybe just medication.
Like kind of a miracle.
Just feel better.
Yeah.
Zone out.
That would be great, I think.
Get to the ground floor. Take something that would just get me to the ground floor so I can live in the present. I have so many flashbacks going all the time, like a slideshow. I could tell you every minute what I'm seeing, and they're always going. And then in my dreams, I'm hearing what I'm seeing. But I live with it. It's sort of like a schizophrenic or somebody that hears voices. I'm just starting to feel like that's.
Oh, do you think you're schizophrenic?
Can you just become schizophrenic? Can you just all of a sudden become? I mean, it's almost like that because there's so much activity in my head all the time. Now, especially since these two incidents have come up, where but before I was just kind of regulating it, living with it, letting it be a companion, being with it, trying to learn from it. And now it's all back. But I still, that painting always just makes me want to get on that bridge.
Just walk away.
Walk to. I don't know. Love it. It's just such a great picture.
Well, we've got about 5 minutes left.
Oh, not much.
Yeah.
I have dry mouth.
Well, yeah.
I'm not on meds.
Water's good.
Mm-hmm.
Anything you'd like to talk about in the last 5 minutes?
Well, it feels like I'm glad I was able to be so honest about some of my feelings about your things you don't want to deal with.
Yeah, I like the honesty. I don't think you need to feel that way. I mean, I don't think you should feel that way. Well, whatever way.
All the ways.
All the ways. Yeah, whatever way you need. I just don't think you need to feel that way.
You don't.
No.
I just don't know who to blame, but yeah, I feel like I'm carrying too much.
Well, you probably are. Way too much. So maybe you just need to let it out. Throw it out.
Throw it off.
Yeah. I mean, it's been a year. You know?
Yeah.
You can't spend your whole life thinking about this stuff.
Well, it's really interesting. Death is really for the living.
Say that again?
Death is really for the living because they're wherever they are, the ones that are gone. But we're here, and we're the ones that have to bear the burden of their absence. And sometimes I think, why can't you just know that these people are at peace now? They're wherever they are. Maybe that's what that is. A bridge. But I can't. Because they're children, and I was supposed to protect them. I survived. I didn't protect them. I tried, but I can't get past that. When I think of my son, I feel better taking care of him. But he's getting older. He's 17, so that's going to be over soon.
Well, yeah, pretty soon he'll be gone, right? Yeah, see, I can talk about those things.
Oh, well, maybe
Yeah, I mean, that's something we can talk about. I don't have any problem talking about
more present day stuff. Well, I'll if I moved on, you'd be okay, though. You could handle that.
Well, I really could use money.
Yeah.
I'd survive.
Well,
Maybe.
of course, I'll meet with you again. At least once. We'll talk it through. I would never just do a cutoff. I can't do cutoffs right now.
That would be good.
Because I just can't. I can't. I have too much attachment.
We'll talk about it.
Okay.
So I guess you want to come back next week, huh?
Yeah, I will. Yeah, next week I'll come back.
Okay. Well, yeah, we'll both think about it. We'll come back next week. I was going to research. What did I say I was going to research?
Oh, compulsive checking.
Compulsive checking. Yeah.
And then
Yes.
the order.
Yes, the order. Yeah.
Compulsive
So,
order.
yeah, I will check on that. No pun intended. I will look into that.
Look into that.
Yes. And
So I'll see what I can.
and I'll see what I can find about that, because that's unusual behavior. But
It's really uncomfortable, and I'm finding it's bleeding into other behaviors, like the door checking, and then also hand washing.
okay, yeah. Well, let's not talk about anything else today.
Okay.
Because we've got to stop. And we've got a couple minutes left, but I don't really have anything else to say today. Do you?
No, I think I'm okay. I feel kind of numb and kind of like I can just go home. I won't walk into a room set phones.
Okay. All right, let's stop here.
Okay.
And I'll see you next time.